as possible. And I also have included some pictures too. So I'm going to share my screen here in a moment. And let's see, let's get right into it. All right, so this is our clinic here, but let me get right into our talk. So, did you know that knee pain is one of the most common complaints of Americans of all ages? This is something that we see a lot, and it is fairly common. People, you know, most people over the age of 65 have experienced pain in some sort of way that they would need to see a physical therapist. And the majority of time it is for knees or backs for that matter, but we see a lot of knees. Another fun fact about knees is that you are not born with kneecaps, and you can kind of see the kneecap there in a little bit. The kneecap is developed after you're born, and it is so unique to each person that you can identify the person based on the type of kneecap, the design of their kneecap, very similar to fingerprints, which I found was a pretty interesting fact that, you know, as I was researching stuff for this talk, I did not know that. So that was an interesting tidbit that you can share with your friends as a did you know? Now, moving on, what causes knee pain? There's so many different types of causes for knee pain. You know, you have chondromalacia, patella bursitis, patellofemoral syndrome, torn knee cartilage, iliotibial band syndrome, collateral injury, Baker cyst, and probably a dozen more that I'm not talking about, all happening at the knee. We are able to identify each of them individually and let you know in our sessions what we believe it is, and many times we are spot on based on the type of tests that we can do. With that, it is, you know, easy to look at an MRI and also see those issues, but sometimes those MRIs can be cloudy due to swelling in that area, and that is definitely something that you have to think about. Now, knee arthritis, though, is probably the most common thing that we see. And that's something that we all develop as we age. Arthritis is not uncommon, and arthritis kind of looks like this. The osteoarthritis, you have a normal knee on your left-hand side, and on the right-hand side, you have the breakdown of the cartilage. And that breakdown of the cartilage can cause pain, and especially occurs when that knee is in its extremes, either full extension or full flexion. The other part is, as we age, we get a decrease in the size of our meniscus, because just like the discs in our back, that meniscus shrinks a little bit. It decreases in size, it decreases in cushion ability, and it also develops tears over time. So that decrease in meniscus, which is the layer between these two bones, can also cause pain in the knees. And these are things that we're going to be talking about today, and how you can modify exercise to prevent irritation of these things, especially as we age, but also prevent injury to these things as we age. Now, bone spurs is another thing that can develop that I didn't mention before, and that's absolutely something that almost all of us have as we get older. And those are little protrusions of bone that will impact the soft tissue in the joints, especially during periods of extremes of like extreme flexion, extreme extension. Those are the areas. Now, if you're younger, and I say younger, I mean, you know, under the age of 25, you don't have to worry so much about these unless you've had a previous injury. However, the interesting thing is, and the reason why I say 25, is that if you've experienced that knee injury before the age of 18, you are most likely to develop knee problems, knee issues by age 32. So that is why we say if you're younger than 25, you really don't have to worry about some of these things. And when you look at some of the exercises that are being done and advertised out there, there are a lot of times performed by people who are, how can I say this? Either genetically superior to all of us, or they're younger than all of us. And so the good thing about what Pearl and Crystal have been doing here at FitBody is that they can look at what you're doing and they can modify the exercise to you. And that is a very important thing to look for in your trainers, that the ability to modify exercises for your issues, for your body type, for your needs. And that's something that you do not always get. And that's something that is, it is very unique and a very good benefit that Perla and Crystal provide. Now, let's talk about things that people don't do with their knees, but they should. And the number one thing is stretch. Taking time to warm up prior to exercise. So remember to warm up at least 5 minutes using some type of light cardio, then you stretch. For the knee stretching, make sure you stretch the quads, which are on top of the thigh, the hamstrings and the back of the thigh, the calves, and glutes, which are obviously the buttocks. Those muscle groups play important roles at the knee. Everyone likes to stretch their hamstrings, and yes, that's very important. But stretching the quads and the calves and the glutes take a priority over those hamstrings, which is an interesting thing that a lot of people don't kind of consider. But looking at the biomechanics of the knee, those are the areas that are usually overly tight on people and cause the most damage. We do see tight hamstrings, but those tight hamstrings can be due to other factors rather than, say, a tight muscle. So the other thing that you want to think about is only going to the gym one time a week. That is not very effective, and it can also lead to injury as well. Being consistent with your exercises twice a week or more is going to be very important. This will help improve your strength and in reality, avoid injury because of that. Anti-inflammatories, the Advils out there, that type of thing. People don't use these in the right ways. And in my opinion, they should be used for short periods of time. I hear about people using them a couple times a day, every day for years. And that is a recipe for disaster for your joints, for your ligaments. And it's not healthy either for your body either. Using anti-inflammatories is important. Don't get me wrong. This is something that we should all do from time to time, but relying on the pain meds or anti-inflammatories to get you through a workout is only masking potentially hurtful situations. So that's something that you really need to watch for. So, people ask if we should take my pain meds before exercise, and I say absolutely not. You want to make sure you're in tune with your body, and you don't are not numb to any of that. Take time to rest. The older we get, the longer it takes for our muscles to recover. Give your muscles and your joints time to recover and repair. Sometimes on some weeks, it's going to be shorter than normal, and other times it's going to be longer than normal. Listen to your body. Being sore after workout is totally normal. Muscle soreness is acceptable. It's expected. However, you shouldn't jump right back into exercise maybe in the next day of those muscle groups, of those muscles that are sore. You should take a little bit of time and let them rest and heal. Let them repair, because they're sore, because they've been broken down, and the body needs to repair them so you can make goals. So working different muscle groups on the days that you're sore is very important. So you don't have to stop working out. You just have to change it up a little bit. and know that if you're sore for 2 days after a certain exercise, the next time you come back, you might need to decrease it just a little bit. Being sore for a day, or for some people, you're not sore the day after, but it's the day after that they're sore, and that's okay too. But if you're sore for 2 to 3 days consecutively, then it might have been too much. You just have to decrease it. And that is different for every person. So, and that will change from month to month, season to season. You just have to listen to your body and tweak things. And that's another really important reason to have, personal training, the fact that you can communicate that with your trainer and they can decrease or increase your program accordingly, opposed to you doing the guessing work on that. So that's a very important point to remember. Now, let's talk about things people do too much. And too many exercise sessions in a row, working the lower body 3 times a row instead of 3 times a week. We've all done that at some point, but it's really important to give that rest, kind of what I was talking about before. Work your upper body one day, then the lower body the next day. Listen to your body for the amount of rest in between. There's important things. Another thing people do too much is stopping their program entirely. That is just not healthy at all. You're going to lose a lot of the gains that you made. In fact, you take 1 week off of the gym, you're going to essentially erase the last 3 to 4 weeks of progress that you made. You lose muscle 3 times as fast as you put it on. So think about that the next time you decide to take a break. You really need to communicate, what is sore, and you need to just rest certain areas, but continue to exercise other areas. In fact, they found that people who stop exercise completely, if they've maintained a consistent exercise routine, develop injury. They develop tendinitises due to that. So it's an interesting bit that our bodies are meant to move. Our bodies need that movement, and it's not healthy just to go to a complete stop. Fight through the pain, because giving up hurts more. I was laughing at this morning because I put this slide in here because I want to talk about fighting through the pain to complete the exercise. Now, I mentioned before muscle soreness and joint soreness, and those are two things we need to understand before, as we exercise. We need to understand our bodies, and those are two different types of pain. And if it's muscle soreness due to workout, that's fine. You can work through that. That is totally healthy to do, and expected as well, because you want to start to break that muscle down to repair it. However, if you're having joint pain, or if you're having ligamentous issues, nerve pain, those are things that you need to stop with doing that activity or modify it. You want to avoid those. So the type of pain is very important. So yes, fight through the pain. There should be parentheses there, muscle pain, because other pain is not healthy to fight through. You're only going to add to issues down the road, and your body will give you little hints here and there about things, and then eventually they'll just slap you in the face with a rough injury because of you not paying attention to your body. So I talked initially about avoiding full extension and full flexion. And this is an example of full flexion and how this is not very healthy for your knees. And the reason for that is because when the knee is at full flexion, which is what you see here on her, there's the highest compression in the knee, both on the ligaments, but also on the joint surfaces. Now, if she was in her, 20s and such, that's entirely different because of healthy joints and tolerances and such. But like I showed you, as we age, we have decreased tolerances in our joints. Our meniscus at the knee has been damaged in the past. It's decreased. Our ligaments don't bend and move as well as they did in the past. And our joint surfaces aren't as protected as they were before. So your risk of injury is higher. Now, the benefit of doing an exercise like this is really not there for the risk, because you can exercise the muscles in other ways and not get this type of risk that's associated with this type of exercise. Full extension is the other one I'm talking about, full extension, full flexion. So completing, say, this squat and then locking the knees out fast. That locking knees with doing the same thing. So that full extension with weight bearing is also just as bad as full flexion with weight bearing. So just a thought. So ways you can change your workout, especially if you have knee pain, is wear a knee brace. And you don't have to get fancy ones. I mean, there's some really expensive knee braces out there. And yes, you can buy those, but the neoprenes that you buy over the counter at Amazon or CVS will be just as good. There's lots of different types out there, and there's a type for each type of knee discomfort and knee pain. You see 3 to 4 different types here. You see your basic ones, you see the patella straps, and then the patella controlling devices, and in the back you see just someone wearing a compression type of pant, which will help with the knee pain as well. If you have knee discomfort or knee pain, wearing any type of compression around the knee will help. It'll remind you to pay attention to your knee. It will remind you to keep in good posture, and that compression will feel good. The one thing people don't realize with these knee braces is that they don't last years. They don't last months. In fact, 6 to 8 weeks is about getting to the end of the lifespan of a knee brace. So if that's the case, buy another one, and you don't have to spend $150 on a knee brace. Buy one for $30 and then buy it again in 8 weeks time. Because you got to remember the neoprene stretches, the elastic that it's made out of stretches just like anything else would, especially if you're using it consistently. And that's just something like a sneaker you're gonna wear through over time. So a knee brace that's been there for years is just not effective. The other thing people should change with the workout is more glute exercises. And I know Perla and Crystal work these because it is so very important for your knee health. It is important for your back health. It's important for your foot health. It's important for your hip health. It is neglected. And there's so many different ways to do it. And so if there's a way that you don't like or just doesn't feel good, find a different way. Ask your trainer, hey, can we do this a different way? Because there's literally 1,000 ways to exercise your glutes, and they're so very important. So hyperextension, we talked about that knee, avoiding that knee extension. Don't fully extend your knees with your exercises. Because if you can do the picture on the right here, when you stand straight and you lock your knee out, that's not healthy when you exercise. It's not healthy when you stand either because of the compression at the knee. Keeping that knee in that what we call neutral position where it's not fully extended is going to be healthy overall. And that's something to consider when you're exercising, is not to lock out your knees. In fact, controlling your knee to prevent it from locking out is a great exercise in itself. And we teach that with our patients, is being able to know where your knee is in space and to avoid that locking out position. People do that a lot going up and down stairs. They force that knee back and they're relying on the bones to stop them rather than their muscles to stop them. And that can deteriorate over time. Good posture is important, but another thing to kind of avoid exercise wise, if you have knee pain, is sumo squats and excessive sumo squats, where you see this woman doing. And the reason for that is because of the pressures it applies to the internal knees. Now, if you don't have knee issues or you haven't had knee pain, you can absolutely do these. But if you have meniscus issues, especially medial meniscus, you should be avoiding the sumo squats because of the pressures that apply to the knee. And this is my opinion. I'm not a big fan of sumo squats because of what it does to the hips as well. People do them because they don't have good range of motion at the hips, but they're only adding to issues to their low back because it just increases the tightness at their hips, and which then in turn increases issues at the low back. So I want more of like a neutral squat when I talk about with my knee patients or my hip patients or my back patients. And this is a great, I'm sorry it's so small, but this is a great example of a neutral squat. And this woman is doing it perfectly. She has good posture with this. And this is another great reason to do this with a trainer, because they can take a look at that. They can say, hey, you're shifting your weight too much to your right foot, and too much pressure on that right knee. You got to shift your weight more in the center. And you don't see that unless you have someone looking at you. So just a thought on that. Now, we use a laser at work to help with a lot of knee pain, and it's been very effective. This is Karen, my wife, using the laser on a patient with knee issues. And in this situation here, the laser was the one thing that pushed the needle forward with this knee patient. And it's kind of a ego killer for us in some ways. Like, we think that we can do it all. And then, we asked the patient, what was the most effective thing for you? And they say, oh, it was the laser. I was like, it wasn't my hands. And no, it was the laser. So the laser's been a blessing and a curse in some ways, because it's killed our egos in some ways. But the laser has been effective for a lot of knee issues. It's not an end all be all. Don't get me wrong. It doesn't work on everything. But for the cases that it does help, it's very, very effective. So I'm going to stop sharing my screen here. Or at least try to. No. Yeah, there we go. So does anyone have any questions about knee issues? Or anything else for that matter? I'd be happy to talk them through that.
I do.
Yes.
Since I've had at least 5 of the things you mentioned, I think, in my lifetime. So sumo squats, when you were talking about them, was it just the weighted ones? Because that was the picture, or any that go down really far?
It will depend on what you're feeling. I think that if you have a knee issue, and specifically a medial, which is the inside of the knee opposed to the outside of the knee, knee issue, I would avoid sumo squats with any type of weight. Now, if you want to do a body weight, or even better, if with a TRX band or holding onto the back of a chair, and that's fine. That's good.
That was my next question. Is it okay with the TRX strap?
Yeah,
okay.
the TRX straps are great for that type of thing. That is absolutely okay.
Sure.
But if it's weighted and you're doing, and that's all you're doing, because we've heard of some people, that's all they do is sumo squats. They don't mix it up. That's where you run into the issue. And maybe I didn't quite, clarify that well. But that's where I have issues with only doing sumo squats. Which puts your hips like this, your feet like this, and it puts a lot of pressure on the inside of the knees. If that's all you're doing squat wise, because that's what you can do based on your range of motion in hips, it's not going to be healthy for the long term.
No, especially if you have bone on those inside of your knees, which I do.
Yes.
How does it affect the hip? I wonder, just while we're on the subject. Taffy, I don't mean to interrupt, but just on the topic of the sumo squat, how does it affect the hip, Brian?
Yeah, so that's a great question. Because of the knees are out like this, you are shortening the external rotators at the hip, which for many people are already short because of the tightness in those areas. Remember I talk about how tight the glutes are in those areas?
Yep.
And you can see that when you lay down in bed like this, and you let your feet rest, your feet go out to the sides. Right? Not many people, their feet go in. Some do.
This one. Right?
But some are like this. But if your feet fall off to the sides like that, you have tight external rotators. So if you're just continuing to exercise those tight external rotators, you're really not adding to anything. And I think that you have to work those internal rotators. The knee wants to be in line. The body wants alignment. And it's harder to keep that knee in line with the feet without it torquing sumo squats. And then if you have tight external rotators at the hip, which are common, you get a lot of rotation of the pelvis based on where they attach to the ilium, the pelvic bones. So then you start to get into back pain, and we see a lot of SI joint issues because of the tight external rotators. So that's where I'm coming from with the sumo squats.
Okay.
I'm not opposed to them, and they're a great way to get people started with squats, especially if they have hip tightness or hip pain, hip groin pain. But I prefer to stretch and to move out, but that's.
And would, Ryan, just one last thing, like a piriformis stretch or something like that for that sort of thing would be a way to help with that.
You're absolutely right.
Okay, got it. Got it.
Yep.
Thank you.
I have a question. Right, like where your knee meets your leg, like right here,
Yep.
the bone is sore. Now, what can cause the bone? It's not the joint, it's the side where the bone is sore. Since I've lost weight, things are starting to readjust and everything on me. So I was wondering what would cause the bone itself to be sore.
So Jackie, is that on the outside of your knee or the inside of your knee?
The inside, like right here.
Oh, is that your right leg or left leg?
It's actually my left.
Left leg, the inside right there.
Yeah.
So that inside can be a few different things. It can be the joint surface itself. It could be the meniscus, or it could be the medial collateral ligament that's there. Most likely, if you're talking about bone pain on the inside right there, it's probably the joint surface itself from the meniscus issues in that area. So again, you're going to want to watch your knee positioning and looking at your knees in the mirror and making sure they're even when you're squatting or stepping is going to be a big thing. Like going up and down stairs is a perfect example for that area specifically. Because if you go upstairs and your knee starts to go in a little bit, you're going to put more stress on that spot. And so keeping it more in line when you're going up and down stairs is something to think about. So next time you go up and down stairs, try to look at what your knees do as you take that step. So that left leg, as you put it up on that step and you start to put weight on it, does that knee cave in or does it stay straight? What's it doing? Or does that knee go past your toes? All those things are going to contribute to that spot specifically. And that will go away once you start to stretch out the quads a little bit and strengthen the hamstrings of all things.
Okay.
If you strengthen the hamstrings more than the quads, it'll reduce tension on that area because it'll prevent the hyperextension that can occur. And the other thing is avoiding crossing your legs when you're sitting watching TV.
Yeah.
Because hyperextension, compression, right? If you put a pillow underneath your knees, that's totally fine.
Right.
You can do that all night long. But if you put your feet up on something with them crossed, like we always do,
Yeah.
you got your knees in hyperextension, and you're essentially just pushing the two bones together. And if you don't have a lot of cushion there, you're just going to have increased irritation and that deep-seated bone pain that people get, especially when you stand up, you take a few steps, you have to limp a little bit because it's so sore.
I have a question. Jackie, why is this the first time I'm hearing of this said knee pain?
It just started in the last week.
All right, because use your coaches.
And I know it started in the last week. I thought it was just, I overdid it and everything because I started walking more. And that's when it started, when I started walking more. Chappie and I have been walking and stuff, and it's just started the last week. And I just thought it was, honestly, not to make a joke, but I had so much fat around that area that I just thought it was like everything just shifting and it was just sore from, so this is what's going
Well, I mean, and you're not wrong. Fat does hold things in place sometimes. I mean, anyway.
Hopefully
No.
you're not catching my knee problems.
No, but Ryan, one of the
have
things I
not.
wanted to say that I thought was incredible was the way you differentiated. I used two different words. You said, like, is it muscle pain or is it joint pain? I'm like, is it pain or discomfort?
Mm-hmm.
Because right when we are exercising and that soreness, which, some people live for, it's discomfort and it's okay. So do you have any tricks or ways that you get your patients to describe the difference?
That is hard to do because people,
It's so hard.
pain is so subjective and it differs from person to person. It is really, it gets down to what it feels like. If it's sharp and shooting, then that's most likely not muscle.
Right.
If it's deep and achy, it's most likely not muscle. Or if it's kind of like a toothache, again, most likely not muscle. If it hurts, it's sore. You can say, where is that specifically? And if it's outside of a joint and area and more in the muscle, then that's, definitely something to kind of push through a little bit and to be expected. And you really want to kind of push the body a little bit. That's important. I just gave a talk on bone health and how it is so important to push the body and to its limit without going past that to hurt and damage. So I think knowing what your body is, and as at the trainer, you can help your clients through that by kind of talking through that, because you've been on both sides of that, and you're very in tune with your body.
Well, we have our ways of doing it. I was just hoping that, I just picked up a couple more ways or thoughts from well, how does Ryan describe this or ask the question? So
I like the sharp and shooting, deep and achy, toothache,
Yep.
Cool.
That's awesome.
So sometimes people are so removed from their body that they're just like, I don't know. I'm like, well,
it all hurts.
I'm like, let me, and I can't quite touch anybody right now.
It's old age, no.
Right.
Yeah. It's it's not an easy thing for people to talk about, but once they start to understand, where pain comes from and what it feels like, they can become more in tune with it. So
I used to have a lot of knee pain when I was overweight, and I don't have that, just going up and